Today we're going to be doing the Ulthera. And what bothers you?
The most important is for me is bothering me is my jawline. It's just that area.
Uh-huh.
And I'm thinking
A little bit of loose skin.
The loose skin here. And a little bit that part. And I believe maybe a little bit my eyebrow. Lifting eyebrow.
Wonderful.
And that's these two things is bothering me.
You lay back down.
Sure.
I'll be wiping off the numbing cream for you. And a little bit about the Ulthera. The Ulthera has kind of revolutionized the minimally invasive skin tightening procedures that we have. Obviously, this was all pioneered by Thermage, where we had monopolar radio frequency devices initially doing a lot of the skin tightening and minimally invasive lifting procedures, but Ulthera is able to penetrate deeper than most radio frequency devices. So we're going to go ahead and mark you. I'm going to have you bring your chin way back. Can go back to doing whatever she wants to do. People generally note that they have a little bit of pinkness or redness, but that usually dissipates within 24 hours. So that's never a problem, and it's nothing that makeup can't hide. So here we have a nice clear view of her submental dermis and fat. And that's the beauty of this technology, is that it actually allows you to see where you're delivering the pulse, unlike a lot of the radio frequency devices out there or other skin tightening devices that exist. And so far as I'm going to go ahead and start. So I'm going to have you take a nice deep breath. And I'm going to deliver. And how was that?
It's okay.
Yeah. A pain from 1 to 10, 10 being obviously labor pain. What would you call that? A 2? If you kind of look at her straight on, what you can kind of appreciate is that this side is just hanging more. This looks tighter and higher than if you look at this kind of more redundant, saggy skin. And if you look at her over here, you can appreciate that her neckline is like the jawline is just cleaner, like one of like a later 20-year-old or 30-year-old. Where if you see it over here, she still has this, and you can't. It's not as tight. It's still a little loose and saggy there in the jowl area. So the nice thing about Ulthera is that you can appreciate this instant contraction. How was the treatment for you?
It was great. It was great. It didn't have any pain. It was like a rubber band goes some area, like a rubber band goes to your face, like a tingling, and some area you feel the pain. But with the numbing cream that take care of that one.
Right.
But I feel the tightness of the skin definitely. I feel the tightness and pulling of this face. I love it.
Wonderful. So we're done with the treatment. I'm just kind of cleaning the ultrasound gel off. And as you can see, she doesn't really look that red. I mean, we were just done, and this is the kind of, you know, pinkness that you see. It's so mild. Unlike the other side that we finished about, let's say, 40 minutes ago, and it's already gone. So it's very transitory. Nothing makeup can't cover. She can easily go out, you know, and move forward with her dinner plans tonight without any difficulties. And how was it ultimately?
It was great. It was great. I didn't have any pain or anything, and I feel great. It's very tight. I feel the tightness. Thank you very much for your time.
Absolutely.
I definitely recommend it.